if you're deficient in any of these, that we're actually able to recommend a dose and a protocol that is helpful for your blood work and personalized. You can't get better data. This is looking right under the hood. So it's not a one size fits all. And then we tweak, you remeasure again. And that's the important thing about monitoring. You're able to actually make informed decisions when you have data.
Welcome to Personalized by Vitamin Lab, the show where we dive deep into the world of personalization in healthcare. I'm your host, Dr. David Dizer. Please remember that the following discussion is for educational purposes only, and it's not intended to diagnose or treat any disease. Speak with your healthcare practitioner first before integrating anything that you learned today. Join us as we explore the remarkable stories, breakthroughs, and possibilities that come with the pursuit of personalized healthcare. Welcome back to Personalized by Vitamin Lab. I'm your host, Dr. David Dizer. This is the show where we explore the frontiers of personalized health and wellness with today's thought leaders in this area. Today on the show, I spoke with Issmaeel Lawendy. Issmaeel is an experienced pharmacist, healthcare innovator, and the founder of Gambit, a company that's transforming the landscape for men's health through accessible, high quality, and most importantly for our show, personalized care. With a strong foundation in pharmaceutical sciences and executive leadership, he spent the last few years developing, growing Gambit to address these vital areas: hormone optimization, sexual health, skin health, all along the way breaking stigmas and empowering patients to really take control of their well-being. In this episode, we dive deep into the nuances of testosterone replacement therapy, exploring how it should be customized, what patients need to know before starting, and how Gambit is setting a new standard in hormone care. Stay with us as we unpack a thoughtful, expert-led discussion on personalized hormone therapy with Issmaeel Lawendy. Thanks for tuning in. Enjoy the episode. Welcome back to Personalized by Vitamin Lab. I'm your host, Dr. David Dizer. Thanks so much for tuning in. Today, I get to chat with my friend, Issmaeel Lawendy. Good to see you, sir.
Good to see you. Thanks for having me, Dave.
I'm excited to chat with you. Like, you know this about me, that in my profession, we are not able in my province to prescribe testosterone replacement therapy, although it's such a valuable therapy. My experience has been that I refer people to your organization. People do really well with it. It's obviously so important to keep testosterone levels normal, to feel good and perform well. And, you know, our modern life is not really set up for like optimal testosterone levels. So your services become incredibly valuable. Talk to me about how you define personalized care in testosterone replacement therapy.
So a lot of people, when they get on this journey, they start to realize it's a little more nuanced in Canada to be able to get testosterone. So they don't really know how to go about it. And we have a gap in our healthcare system in the sense that if there's, something wrong, we'll fix it. At Gambit, we look at, and when I was founding this company, my motto was prevention is better than cure. And how can we actually find, a care plan that is personalized to the individual, that actually looks at it holistically? At Gambit, we care about how you feel. A lot of doctors treat numbers. Although empirical data is completely important in administering care and in putting a care plan together, like blood work, but symptoms are really what tells us what's going on with the individual. So the personalized care is the only way forward. Most people are realizing that it's not just a one size fits all. It's not one method. It's holistic. You have to fix your diet. You have to fix your lifestyle. You have to help fix your mental health. And then in that regard, on the back end, we're working on optimizing your hormones, making sure they're in the upper limit of normal so that you're functioning in the best capacity possible. So personalized care is, I think it's where it's at. And I think most Canadians are starting to kind of realize that. I'm happy to go with a private clinic now to make sure that I'm actually getting that type of care, that concierge type of service that actually cares about me, cares about my symptoms, cares about how I feel. I've had patients say, I've gone to my family doctor, he looked at my back hair and said, hey, I'm okay, I don't even want to test you, your testosterone's fine, right? So there's a deafening voice of the patient, I think, in Canada. And I think that it's this gap is starting to be filled by other private clinics. And I think doctors are awakening to this as well, that we need to do better and we need to do more.
Isn't it true to do really well in this realm as a physician? You need to have some skills, you need to have some experience, some training, like to really support someone here. Like you mentioned about symptom and supporting the person in front of you. Doesn't so much of that come from training? Like I just think about my family doctor friends and how they're so good at managing cardiovascular disease, like actual disease, like so much better, more talented than me. They have so much skill. Like they're so good at switching people from antidepressant to antidepressant flawlessly, like just smooth transitions. But like when it comes to prescribing testosterone or supporting someone with the symptoms that we'll review, I mean, they just don't have the experience or sometimes the willingness. But talk to me about like what it takes to be good at this. Is it hard? Is it easy? What's it like?
It's really I think the issue that Canadian doctors are facing, especially family doctors, is that testosterone got a very bad rep through anabolics, and so it was kind of like this a controlled substance. It's usually abused. We got to stay away from it. It has cardiovascular problems, and emerging research is really debunking those things. And when they were in med school, I mean, my brother's a surgeon, and I ask him about this all the time. My partner is the head of internal medicine or program director of internal medicine at Victoria Hospital and
No
associate
way.
professor of medicine at Western Ontario. And, most of the doctors, they take a course or maybe a couple days of a course in med school about testosterone and then it's shut off, right? So it's kind of like, no, you're fine. The range is in Canada is so high. So a normal range is, I think in BC for you is like 7.6 nanomole per liter to 31.2 or sometimes 28.8, depending on the lab. So
Yeah.
you get this huge range. Like I'm 7 years old, let's say, and my testosterone level's 10. I'm normal. Well, I'm 35, let's say, and my testosterone level's 11 nanomoles per liter. Well, I'm still considered normal,
Mhm.
right? So there's this red tape that I think has come with testosterone, at least in our country. Like if you look at the States, they're a lot more advanced in functional
How
medicine.
so? How so? How are they more advanced in this realm?
The laws are a little more lenient, I believe. They have a lot more approved, peptides, other therapies, and they're willing to push the boundaries a little more. And I love Canada for the fact that we're cautious and we make sure that it's safe, and that's very important, right? That we're following safe protocols. But we have to break the barrier here. We can help people while following safe protocols and optimizing their care. The system doesn't have to be completely broken for us to treat. We can help people that are going through this. And with our lifestyle now and our food and our intake, there's so many endocrine disruptors. You're finding testosterone levels, like we just see it in our own practice. I mean, I can't tell you that I have accurate study data here, but I see it where I have patients that are younger. If
Mhm.
you look at patients in the 70s, their testosterone levels were much higher. It had to do with their lifestyle for sure and their diet, right? So we work, some of us work 2 jobs or 3 jobs. That's just crazy. You're not sleeping. I deal with a lot of cops. That's one of our main. We did a thing with the London, Ontario police here, and a lot of officers that work 12-hour shifts, right? They can't 3 days on and then 3-day nights. They can never get a regulated sleep pattern. It affects their relationships, it affects their testosterone levels. So we're finding that, this is happening more often. It's more common than people think. And there needs to be more awareness around this, that it's okay to get help. It's okay to start therapy if it's safe, of course, and if the blood work and your symptoms are there and it's done with proper guidance from a specialist, right? And proper monitoring.
Yeah.
So we're seeing a lot of men are really doing well. Like we have people tell me, hey, Ishmael, you saved my marriage.
Yeah.
Like, or I was about to get fired. I had no motivation. Every day I wake up with the same brain fog. I'm easily irritable. And honestly, I didn't know that I would feel this good in 6 weeks, right? So it's crazy, like how people's lives turn around. And then don't get me wrong, there's people that, they try to come and they want to use it for anabolic purposes and they want to get in the gym and they go, and we don't do that. So
Yeah.
we're like, listen, this is replacement therapy. We're here to keep you in the upper limit of normal. That's what we want to do. We want to make sure you're optimized. We don't want to give you 5-6 times the dose,
Yeah.
and ruin your endocrine system and potentially other side effects. So we do it in a very controlled manner. We've developed awesome protocols, and we serve thousands of Canadians every day.
Wow.
So it's been a
Amazing.
crazy journey. Yeah.
Vitamin Lab revolutionizes personalized supplements, empowering health practitioners to create tailored supplement formulations that address each patient's unique needs. Bring personalized health to your practice and choose from over 200 professional-grade ingredients to create vitamin formulas that improve patient adherence and result in tangible outcomes. All ingredients are sourced from the world's most trusted suppliers, and Vitamin Lab provides hands-on support to help you formulate and launch personalization to your patients. Say hello to a new era of personalized supplement solutions. Go to getvitaminlab.com/personalized to save $100 off your first formula.
That's awesome. That's awesome. Tell me about some of the symptoms. You mentioned a couple there with the brain fog, for example. What are some of the
Sure.
symptoms? Like say someone's coming in that, they're an 8, 9, or 10, which we see all the time on the Total T, by the way, all the time. What are some symptoms that, inspire them to say, oh, I'm going to check in with Get Gambit?
A lot of what we get is, hey, I saw Mike at work and this guy was dragging his feet 3 weeks
Right.
ago. And now
Right.
he's got this
He's a
pep in his
changed man.
step. He's laughing more. And honestly, and this really happens. And then they ask Mike, what are you doing? And he'll say, actually, you know what? A lot of guys, and this, when I started this, I'm just going to divert from that for a
Please.
sec from the
Yeah.
symptom. I'll bring back. But when we started Get Gambit, a lot of guys were, I want to keep this secret. I don't want anyone to know that I'm getting help. And we had that, barrier to cross. And that's actually why I named it Gambit. Gambit is to kind of, we try to look for instance, the X-Men. He was the hot guy with the long hair. He got all the girls. And we tried to take that direction. We were like, what? I like chess. So, the Queen's Gambit and,
Right.
a small sacrifice for a greater position. We said, that's the name. You have to take a chance on yourself. You have to be willing to say, okay, you know what? Enough is enough. There's something going on here. It's not just aging. I shouldn't
Mhm.
feel like this regularly. And back to the symptoms, they'll start to feel, fatigue, lower libido, irritability. They'll start to deteriorate in sports, in the gym. The recovery time is a lot longer. Motivation tanks. That's a huge one for people, right? Where their motivation is just in the toilet. And that's literally the words they use. The brain fog is big. So like when I decided to found this company, I was a senior vice president in pharma and I was traveling a lot. Like I was in Calgary and our head office was in Manitoba and I was all over Vancouver and I couldn't get to a doctor and it was COVID time. And I'm pretty connected. Like my brother was a physician, right? And like I should be able to find a specialist to help me with these symptoms, and I begged my family doctor. He finally said, okay. And he tested me and I was suboptimal. I wasn't low, so he wouldn't treat me. And I said, okay, you know what? Maybe it's not testosterone. And I kept going on my day. And it just started to decline. Like my motivation again was in the toilet. The brain fog was serious. So you wake up, and usually my mind is very sharp. Like right when I wake up, I can process facts right away. But there's like this 30-minute lag. I'm like, what's going on? It's almost like you have this hangover effect in the morning. And that's when I was like, you know what? There's something wrong here. I finally decided, you know what? I'm going to start Get Gambit. We're going to focus on men's health because it's very underserved. And most men will live with their problems. I mean, I was one of them. Social media has really changed that because a lot of people are coming out and saying, you know what, you don't have to live with that. And that comes to the second part of our logo is the DNA. Is, you know what, these things are intertwined in your DNA. And 20, 30, 40, 50 years ago, we thought, hey, we have to live with these problems. But now there's these solutions. Like, I went bald before I knew about the hair loss treatments that we started, doing, like finasteride and minoxidil and these. If I would have had those 10 years ago and known about them, I wouldn't maybe had a full head of hair. So these are things that could have physically changed if I actually took the initiative to take my health into my own hands. And a lot of Canadians are starting to say, you know what, it's time to do that, right? I'm not getting what I need from the healthcare system. I need to actually spend some money on myself. So these symptoms become debilitating. That's the real thing. And then they last, you're gauging 1 to 3 months. Is it over 6 months? And that's when most people come in and they say to us, okay, you know what? There's something wrong. I need to do a check. And that's actually what's awesome about our service is that we don't say, okay, you know what, this is a intake form. You want to do testosterone. We're going to get you in. No, we do a 50 blood and urine marker test. So we're trying to find, why is fatigue happening? Is it your iron? Is your iron low? Is it your thyroid? Is it your cortisol levels? We look at all of that, right? And then we look at deep dive into your hormones. And usually we find that your testosterone is in the lower quadrant of normal or even below normal. You'd be surprised. I mean, 2 dear cases to me, my own brothers, very rare case. I saw one of my brothers, he was gaining a lot of weight. I said to him, hey, like, what's going on? This is not normal for you. And he said, it's tough business right now. And, you make 100 excuses, right? So I like, listen, I'm going to pay for the blood work for you. Fill out this intake form, go get it done. Okay, he sat on it for a year. Obviously, it's his younger brother or whatever, And then he did it a year later. We found his prolactin level was in the over 200s.
Whoa.
He had a prolactinoma.
No way.
Right? Yeah.
Good
And his
catch.
testosterone was 1.
Whoa.
And, and that's what he was telling me. I'm gaining weight. I had brain fog. My libido is gone. Now we're treating it. He's, the tumor's decreasing. The prolactinoma, is decreasing. He didn't need invasive treatment either.
Well,
and
that's
his
good.
testosterone levels are starting to restore. He's lost like 60 pounds.
Nice work.
It's insane. It's day and night. And then my other brother's like, oh, because I have 5 siblings.
Okay.
Yeah, 6 in total. So my other brother and my sister were like, hey, can we get this? And then we found it in my other brother, which is extremely rare.
No.
We found another prolactinoma. It's crazy.
What the heck?
We literally saved their lives.
Goodness gracious.
Yeah.
What's the cause of that? How did that even happen? It sounds so rare.
It is rare, especially in 2 brothers to have the same gene expressions. And so it's pretty crazy. We've caught prostate cancer. We've caught testicular cancer on guys. And we've had oncologists say to us, if we didn't do this blood work, like if you didn't go with this company and do this blood work, we probably wouldn't have seen this for a couple of years.
Oh my God, yeah.
Yeah, so it's crazy. If you're having symptoms, don't ignore them. That's my one piece of advice.
Yeah, that's a good point. Checkups, man. It's so valuable. You find random things all the time. Those are some really great examples of just the value of like having objective data once in a while, especially if you're not feeling great, or something's changing physically. Whoa, good for you.
Even doing it once a year. Like, you get what I mean? Like, what's the problem with tracking? Like, I want to know what my levels are, have my cholesterol decrease. Like, we look at everything.
Yeah.
It's crazy. Even genetically, some people are 32. They don't realize they have high cholesterol and their cholesterol's through the roof.
Right. Yeah.
Right. Or their risk of diabetes. So we look at all of those things before we actually make a clinical decision and say, you know what, we're going to put you on therapy.
Mm-hmm. Now, what are the factors that we have to watch out for once therapy begins? So what are we tracking from there on? How do we know that we're keeping a person safe?
Yeah, so that's a great question. So usually how our program works is we would do something called a baseline comprehensive, what we just discussed, right? Once in the intake form, so we would see their symptoms and all that. Then, Dr. Slim would review all that. We'd have a call with the patient and we'd say, okay, we've ruled out, your thyroid's great, your cortisol's great. We really do think that optimizing your testosterone will help these symptoms. But we're going to do something called a 90-day trial, okay, where we're going to actually put you on therapy. We're going to track your blood work at day 30 and then again at day 70. Now, what we're looking for here is one, what we gave you, is it safe? How is your body responding to this, right? So in 30 days, we'll see that his testosterone levels may be rising. Are they too high? Did we overshoot or did we undershoot, right? And that's also, we always look at the empirical data of the blood work, but we also are talking to the patient,
Yeah.
right? To know, how are you feeling? Those original symptoms, are they subsiding? And some will say, you know what, my libido is getting a little better, but my sleep hasn't improved. I'm feeling a little bit energy, but, my motivation is still low. So we start to track now your levels with your symptoms. Then we're also looking at your hematocrit and your hemoglobin, your RBCs. Now, this is very important. Your hematocrit and RBC count, testosterone will stimulate the erythropoiesis. It will cause the red blood cell production in your bone marrow. So the last thing we want is that we're giving you a dose that's too high to make your blood too thick, right? And that can cause other risks, right? A stroke and clotting. And so those are one factors we look at. Now, a lot of people actually, the doses that we give are they're therapeutic. They're never too high, but they're not too low. So we don't want to also shut down your system and not give you enough testosterone to make sure that you're able to function during the week, right? So we're giving you the right dose. But what most people don't realize is that hormone therapy is not a direct science. It's not like your blood is this, so you're this. Well, there's different age groups, there's different ethnicities, different sizes, right, of different human beings. So it's more of an art and a science. And that's why the blood work is so important, because we have to monitor and tweak, right? We overshot, no, we undershot. And then we've got protocols now that we kind of know this is the range from here to here. This dose to this dose is most likely going to, help what we see. And there's some people that they require a lot more, and there's some people that require a lot less. But the key is to get the right dose. It's not about, I'm taking, some guys will say, no, my friend's on 150 milligrams a week, right? We'll say, but 80 is helping your symptoms. It's keeping you in the upper limit of normal. Like, you're feeling great. Why would we give you double the dose? It makes no sense, right? Increasing your risk of side effects, all those other things. So those are the things that we're tracking really a lot. We're looking at from the blood work perspective, we're looking at their hormone levels. Of course, the testosterone is extremely important, their cortisol levels. We're looking also at their hematocrit, their hemoglobin, their RBC count. So all those things are quite important to continually track. And once you're stabilized, you can move to more of a once a quarter type of, monitoring of the blood work. But I would say in the start, that 90-day trial allows us to tweak the dose. And then if we get after the 30-day test that we do, and he says, I'm feeling great, no side effects, my symptoms are getting better. Okay, great. Let's continue. Then we get to day 70. We test a little bit less. We're not testing everything we tested before, just the essentials. And if there's anything else out of whack that we find, right, in your original comprehensive, we're tracking it, right, by day 70 to 80 or 90 to making sure that we're also taking a look at that, right? We find people that high risk of gout, right? Their urate levels are through the roof. And that's when they would sit with our dietitians and we'd go through, a plan on how to prevent gout and increase testosterone therapy. So it's a holistic approach. And then by the 90-day trial, they'll know, has this helped me or not? And if it does, am I feeling better? And is it safe for me? Okay, let's continue. And then it's kind of like clockwork. We're looking at your blood work every 70 to 90 days. We're renewing you for the next 90-day supply. And then if, we're tweaking later, it really takes about 180 days, though, I found, David, to find the right dose.
Right.
Some people, you get it and you get it right away and they're great. But, it usually takes that 180 days to lock in. And that's when we say when you're dialed in, when you're getting the right dose every single week or daily, depending on if you're taking gel or injectable, and you're feeling awesome. You're not getting any of those side effects. You're not too irritable. And a lot of people think, I'm going to take this, I'm going to get roid rage. The people in the gym that are taking those underground, they're taking like 5 to 6 times the therapeutic dose. We have never prescribed that at our clinic, right? So the doses we're giving you are studied doses. They actually work and they help people. And we can always pivot. That's the best part about this concierge type of service. is that you have us 24-hour access, right? So we're able to help you right away. It's like having a specialist in your pocket.
Right.
It's never happened before.
Yeah, so cool, so cool. Thank you so much for that review. It's very helpful for me who's not in this world very often. You've told me something before about your service, and I think now is a good time to discuss it. And that's the harm reduction program. This is transitioning people those people going to the gym who are getting it sort of outside of the system, and then you stepping in and saying, "Here's the safe dose for you. Here's how to do it safely." Can you tell our viewers a little bit about that program?
Yeah, so when I decided to become a pharmacist, one of the ethical questions that always came up is, well, you have a heroin addict comes to your pharmacy. Do you sell them needles or not? Or do you
Right.
give them needles for free or not? And I always had the answer, of course, you give them needles. But you're going to help them use and abuse drugs. And right, that was the other side of the debate. And it's the same thing here. We have people, a lot of Canadians, that are actually trying to feel better. They've been rejected by their family doctor, and they're now left to do it illegally and to a source that was not batch tested. It's not pharmaceutically manufactured. It's not dispensed by a pharmacy. It's not regulated, and we don't know where it's coming from. And a lot of them are harming their organs. We're finding on their blood work things that have really could be permanent damage sometimes, depending how long they've been into this. So Dr. Salim and I decided we're going to use something called the reduction of harm program. And he really championed this. And he said, I would rather help these patients do this legally, do it in a proper, safe space where it's monitored, and we're able to take them on and to make sure that they're not getting this from a bad source. So we'll actually test you. We'll then prescribe what we think is the dose equivalent to what you're taking. And a lot of times guys will say, well, I'm on 250 milligrams a week. And then we'll test their blood. And it's like, what you're getting is a placebo because
Right.
it
It's
seems
not
that your
kicking in.
testosterone levels are in the toilet. So I don't know what you're talking about, right? And then there's guys that are, I'm on 500 a week. I said, we can't prescribe. That's not a healthy dose. We got to bring you down. And sometimes we titrate, so we can give like 150, titrate down to about 100, or we start them at 100, titrate up. It really depends on what their concoction was, what they were taking. And Dr. Sim and I work really closely on developing this program and finding the right dose for you. And now we can monitor you. You're getting it from a legal source. It's covered by your insurance. You're able to travel with it. And you have to sign a reduction of harm policy where you say, Issmaeel Lawendy will no longer use, let's say, underground testosterone or human growth hormone. And I will adhere to all the blood works that are ordered by Dr. Salim and the prescribed dose. And a lot of these patients are truthful and honorable. They actually didn't have an alternative and they want to do this right. And they're so happy that we can help them because anywhere they go, they've been turned down.
Such a great idea. I think that people don't know about this enough. It'll get out there though. It really will. Hopefully this show will help, especially, I've got a pretty big audience around here. I know people are just, really looking for this therapy and can't find it. So I'm really excited about that. But there's one concern that most of them have. This is what they asked me about, and I don't know the answer. So I need to ask you.
No problem.
Does TRT shrink testicles? What happens long term here? You got to tell me. I don't know.
Yes, so it does. Now, this is the misconception. Most people, their protocols are very rudimentary, right? You'll have doctors or they've been to a nurse practitioner and they'll just write you testosterone and you're like a 36-year-old male. Well, what's the risk of fertility there? Have you talked about that? Testicular atrophy is real. So if the body is smart, if I give you testosterone, it decides the pituitary gland doesn't need to release LH as much and FSH anymore. So it suppresses its release because that's the precursor in actually synthesizing the testosterone, right? The way it normally works is LH comes out of your pituitary gland, signals your testicles to make the testosterone for the day. Now, if you're taking testosterone, it's kind of like the furnace at your house. You set it to 30. When it gets to 30, it shuts down. So if your body thinks that it has testosterone, it's going to stop producing it. And when it stops producing LH and FSH, it affects fertility. Now, this is reversible, so I don't want people to be scared if they're already on therapy and, I didn't know this. No, it's reversible. And if you reach out to us, there's ways that we can help bring that back. And the other thing it does is it shrinks your testicles, and it can cause pain, right? Because LH and FSH, they cause spermatogenesis and help in these things to keep your testicles big and full and healthy. When I shut that down, it does. So there's ways that we can obviously tackle that. So HCG has been, monumental in helping with this problem. It maintains the fertility of the individual. So we are faced this question as clinicians. You have a 25-year-old man, let's say, and he has hypogonadism, which is low testosterone. But he still wants to be fertile. What do we do, right? If we give him testosterone, it decreases his chance of fertility. And fertility is not a known science. I was just blessed with a baby daughter, right? Me and my wife were trying for about a year.
Congratulations.
So thank you. And, HCG really helped. I'm on HCG myself, monotherapy, and that signals your body to produce more of its own testosterone, and it mimics LH. And that keeps your testicles big, it keeps them full, and it keeps your sexual health great. So if you're having this problem and you're saying, you know what, I got on testosterone and now my testicles shrink, well, you need to relook at your regimen. You need to reach out to us. We can help you definitely put a protocol to reverse that testicular atrophy. And a lot of times it's either they're taking testosterone alone or they're taking a dose that's just way too high. So they used to use clomiphene. I don't know if you heard of it.
I know it, yeah.
Yeah. So clomiphene, but it's out of the Canadian market. Sometimes it is compounded as e-clomiphene. We do have a specialty compounding partner that does that for us.
Okay.
But I would say the gold standard has become the HCG,
Really?
which is an IM, intramuscular injection.
Mm-hmm. What's the best way to administer testosterone? Is it creams, injections? What's best?
So this is a great, we get this question all the time. So there's basically two products that I think Dr. Slim prescribes regularly. The gel, and the gel mimics your natural ability, the natural way of producing testosterone, which is daily. So you take gel every day in the morning, you'd apply it, it's kind of like a ketchup packet. You put it on your upper arms and shoulders, 45 minutes, you shower, you wash it off, no cross-contamination to others. Right. But that's 45 minutes every day. Yeah. And when you're a busy executive or you're working two jobs or you're working shift work, you're like, I don't got 45 minutes in the morning, right? So that actually takes a little long. The gel takes a little longer to work because it is daily, but it actually mimics the way your testosterone really is, which is every single morning I produce this amount of testosterone for the day. So after 4 to 6 weeks, when you're starting to get clinical benefit, you'll always have that stable amount of testosterone. Now, when you do injectable, which a lot of people want because it's quick, it's easy, it's once, every 2 weeks, once a week or twice a week, depending on which protocol you're using. Some people do it every other day, right? But it has the peaks and troughs. So if I give you the amount of testosterone, you feel great, Dave, day 1 to day 4. And then you're like, oh, what the heck's going on? Days 5, 6, and 7, I'm starting to come down, right? So we want to eliminate that. So people with mental health, it's not a good option, right? Because you want to make sure they're stable and their mood is stable. So gel is a better option when it comes to that. Or you would have to dose it frequently when it comes to the injectable. But most of our patients prefer, I would think, injectable because of its ease to travel with. You don't need to take a lot of product. I mean, one vial has 10 milliliters in it. That's about 8 weeks supply for most people. So it is an injection once a week, which most people are okay with doing rather than daily. But when I talk to my patients on gel, you'll never have an up and down with them. They feel great every day. When they get to the right dose, it's phenomenal. So some people have made it routine. Where they're like, you know what, I get all my news in the morning, I do, I check all my emails, and they're able to do it, and that's great. I would always say, it really depends on your lifestyle. And we always say that in medicine, you need to give treatment that works for you can't have non-compliance. You get what I mean, Dave? If you're unable to perform that or unable to apply that or unable to do it, then what's the point of treating you with that? It's not going to work, right? Yeah. So we have to make sure your lifestyle fits that.
Yeah, it makes total sense. Yeah, great answer. I haven't considered either method. I haven't really thought about it too much, so it's really helpful for me. But I need you to help me improve my career in other ways. Here's what I need support with. I'm helping people who have been prescribed this. So
Yeah.
I need to know what you think. Like, help me boost up my career. Like, obviously, I measure estrogen a lot. We measure DHT, testosterone. We help people make sure that the ratio between estrogen and testosterone and estrogen is reasonable, that they're not exposed to a lot of phytoestrogens, for example. And we do a
Mhm.
lot of environmental pollutant assays and check and see that there's not a ton of exposures that they're having that's impacting their endocrine system. Can you walk me through what do you think what could be supportive from a naturopathic standpoint, from nutrition to exercise to vitamins to herbs? What do you think has some good evidence to support someone on TRT?
Yeah, so that's a great question. And this is why I think is why I think me and you started talking as well, right? We wanted to make sure we can put a holistic program together. And that's the best part about Gambit is that we're not just doing blood work. We're doing genetic testing, we're doing pharmacogenomics, nutrigenomics, and then we're looking into, companies like Vitamin Lab that really customize the nutraceutical industry for you. So some of the ones that you really want to be on, if you're trying to boost testosterone, and we can break it down first. The question was about estrogen. So
Mm-hmm.
resveratrol, it's found in
Yeah.
grapes, right? That's very good at to modulate the estrogen receptor. It's really helps with its inhibition. And then you get, diandel methane, which is also found in broccoli and cauliflower, that helps reduce your estrogen levels. So those are natural
Yeah.
ways, and you'll notice that if you eat those, you'll notice that the water retention will decrease,
Yeah.
right? If you're getting those side effects, some people, if nipple sensitivity is one of them, or their nipples become more expressed, and then obviously gynecomastia has always been a fear for men, right? Which is male boobs on men. So that's a natural way to get that away. But other things that really help are, we see selenium and zinc. Those are very, very important. Your vitamin D3, like I don't think I've ever tested someone, and maybe less than 2 to 3% that are not deficient in Canada. We just do not get enough. Obviously, the magnesium really helps. You want your ashwagandha. There's some research on tongadali and shilajit. Citrulline malate is really helpful. So before workouts, getting that, opening the blood vessels, making sure you're pumping, working out, getting that blood pumping to every organ is super important. But the food you eat, like a lot of this you can get from your food. A lot of us have really underestimated the power of nutrition. And if you can't get it from your food, I get it. Like we live busy lifestyles, sometimes hard to cook like that. So having a program like Vitamin Lab offers, or like that Gambit offers, that we actually have specialized vitamins, tailored protocols, and it's not just, hey, I'm going to supplement to supplement. That's not at all. We have an executive panel that takes a look at about 15 different vitamins on top of those 50 blood and urine markers, where we're seeing your thiamine, your vitamin A, your E, your vitamin D. We're looking at, all these other different vitamins to making sure that if you're deficient, your zinc, your selenium, your copper, if you're deficient in any of these, that we're actually able to then actually recommend a dose and a protocol that is, helpful for your blood work and personalized to your actual blood. Like you can't get better data. This is looking right under the hood, right? So it's not a one size fits all. And then we tweak, right? And we remeasure again. And that's the important thing about monitoring. You're able to actually make informed decisions when you have data. And I think a lot of Canadians are starting to realize that it's really important to get my blood work done. And it's really important to make sure that I have a specialist reviewing it and I have someone that can actually advise me properly. And it's not just a doctor approach. No, like even having someone like yourself, doctor, like a naturopath, and then having obviously a dietitian and an allied health approach. That's the way forward.
Yeah, I think so too. And I think so many people are tuning into it, but you've broken it into a few different categories here that I want to highlight because I think it's really, really powerful and kind of speaks to that holistic approach. The first was estrogen suppression and modulation of the receptors, DIM and resveratrol. I love that. I think that's an awesome idea. And then we have the nutrient category where it's like, you're assessing for deficiency. You correct for deficiency, people start to feel better, and then the system works better. But what I find is it helps with optimizing for lifestyle. Like people know they need to lift weights. They know that. They know they need to sleep through the night. It's really difficult when your system is completely thrown off because of deficiency. If you're too tired to lift, if you're too tired to stay on point, like it takes energy to be disciplined, like we know we need to go to bed at a certain hour, but we don't get enough time for ourselves. So we want to watch a little more Netflix. If you're deficient in nutrients, it's really hard to keep the discipline. So I really like that. Like you mentioned about the citrulline malate for like improving workout capacity. It makes a difference.
100%.
Right? You get a better workout, you get a better testosterone response. That's that holistic approach. I love it.
In the sleep, we don't take sleep lightly. And like we advise, it's very important. And even all the new research, just a little tangent here on sleep, all the new research is actually telling us, instead of anchoring, like when people want to improve their sleep, they always say, okay, I'm in bed by 10. Actually, that's not the way to do it. You want to say, I want to wake up every day at 5, let's say. So when you start anchoring your wake up time, eventually you're so tired that you'll pass out by 10, right? And you actually start to get a good 7 to 8 hours. And people find that their sleep quality gets way higher. And then another thing about sleep that most people don't realize is 80% of men that have growth hormone deficiency don't even know about it because they don't test it, right? And a lot of, we're finding, we specialize in growth hormone and peptide therapy. And we're finding a lot of men are deficient in their IGF-1 and their sleep is horrible. Their ability to burn visceral fat, their ability to keep lean muscle. I'm in the gym all the time. I can't gain a pound of muscle. My recovery time it takes me 3 days after a workout to be able to even go back to the gym. The next day I'm dead. Like this is not normal. We shouldn't say that this is something that, no, we are very active beings. Movement is life. We always say that in medicine. So it's extremely important to making sure that you're active. So if you're unable to be active really, and you have to fight that, not your psychology, but your physical distress, then there's something wrong. Mm-hmm. And you really need to check that. And it's really not about it. You should be active until 60, 70. Like it's not about age. People think, well, I'm turning 45. You know what? It doesn't matter. You should still be able to go to the gym. Men were fighting wars. They were 50 and 40. Yeah. Getting out of bed has become a war though.
For sure. Yeah, help me learn more about these because like I'm in this world. I basically do exercise physiology for a living, and I've only measured IGF twice and never growth hormone. Well, tell me about is it really just delayed recovery? When should I be looking at these two markers?
So those are the two. Honestly, in diagnosis, we don't use growth hormone because it's a very non-specific marker for us to actually diagnose. We look at your IGF-1, which is very specific. That's your insulin growth factor 1. We also look at your insulin fasting because growth hormone, you have to look at the risk for diabetes as that's one of the main side effects. So there's a risk profile assessment that's done on the patient. And that's why those markers are so important. You can't, if you have a doctor that you just tested your IGF-1, is not looking at, your thyroid function and your testosterone levels, and he really doesn't, excuse my friend, but they don't know what they're doing in that sense. You should get referred to an endocrinologist or someone that's a specialist in hormone therapy or functional medicine, because it's really a holistic approach. We got to see all of that, and it tells us a story, right? So we look at your risk profile for diabetes. We look at your cholesterol levels, your full lipid panel. We look at your IGF-1. We look at your insulin fasting. We look at a bunch of other hormones, and then we decide, okay, do you have these symptoms? I do. And then we have strict guidelines on how we treat. So testosterone is more of a range, right? And everything is a range, but it really differs based on age as well. Like if you look at an 18-year-old's IGF-1 or a 17-year-old's IGF-1, it could be in the 350, 400. They're growing, right? But when you're, I'm 36, my IGF-1 shouldn't be more than 260, 270, right? And IGF-1 also increases when you start to increase muscle training and weight training. So that's a marker that does increase with physique, just like testosterone. But the problem is that most people are they're already suboptimal or low, and they have such, a hill to climb to be able to get back in that rhythm of working out.
And don't get me wrong, there's some people that are, and you know what, they've done everything they can from a lifestyle perspective. And we get a lot of those patients too. They're like, listen, I've done everything. I work out 5 days a week. I eat super healthy. I haven't had sugar in 6 months. There's something wrong. Like I still have brain fog. My ability to, keep off visceral fat is very difficult, to maintain lean muscle. And then the one thing is the sleep. We always see that their sleep is off. So that's when we'll look at that panel. We'll say, okay, you know what? You can add this. It's not something we screen for all the time, but if you want to have a specialized look at it, we can add the growth hormone specialized panel. And we look at it, obviously, with the testosterone. Those are the two real hormones that are extremely important for, first of all, it's men and women. A lot of women think, oh no, it's like skin tightness, like that anti-aging. It's insane. The two things I would tell you that really helps with that is sermorelin.
What is it?
Sermorelin.
Sermorelin?
And that's why I tell you the States is way more advanced than us when it comes to this. But it's actually Health Canada approved, and it's a peptide. It's a secretagogue. And the secretagogue basically, it works on the growth hormone system to actually stimulate more growth hormone production naturally, kind of like what HCG does. So, and that's why you can treat to a certain level testosterone deficiency with just monotherapy HCG. There's a lot of studies on this, and that's what I'm on because I wasn't low enough for testosterone.
Right.
And we look at it as a longevity. Like when you come to us, you're 37, 38, and you're like, well, I'm not trying to just ruin you and get you in for a year. No, we're looking at 5, 6 years, 10 years. So if we can help you with just monotherapy HCG, and then maybe in 3 years we incorporate testosterone, then we've done a service for you, because we don't want to increase drug tolerance. We want to make sure we don't want to increase side effects. So if whatever we can do with the least amount, that's what we're going to do, right? Because later you're going to need it, right? Later you might need that, when you're getting older and you actually you're more deficient and you require to add the testosterone to your regimen. The same thing with growth hormone. So the risk of growth hormone is if you abuse it, it has a high risk profile. So the diabetes, you get joint pain, you can get carpal tunnel, acromegaly. So you see those guys in the gym, their jaws come out like this, hoarseness of their voice. So those are people that are using it in an uncontrolled environment, unmonitored environment, and usually it's underground, or usually it's the wrong dose. I've had other private clinics making, like nurse practitioners sending in, a patient getting a second opinion from us, and they're prescribing 5 times the dose that we would even start you at. So we've even saved people's, lives for real from this, because it really does require a specialist. Now, we look at your IGF-1 and we look at your symptoms. And from there, we can decide whether we're going to prescribe actual bioidentical growth hormone, right? Or we're going to prescribe sermorelin. And the sermorelin works on that system. The good thing about sermorelin, it takes a little longer. So it takes about 3 months to get the symptoms under control, but it's a lot safer, because once you reach the optimal level, it shuts down production. So, you can't abuse it the same way you can abuse testosterone, which is, if I keep upping the dose, upping the dial a bit, and some patients, they do that, and we know, and we'll caution them, and then we'll even cut them off sometimes if they're not listening to the physician, right? But you have some people, I added an extra one. There was some left in the vial. I took a little extra, right? And that can actually cause those side effects. But if you're staying within the prescribed dose and we're monitoring, it is quite safe. But, the sermorelin is a safer approach. It is a longer approach, but it is the safer approach. And some people, sermorelin won't help them. It's just they're actually extremely deficient, and we need to get them back to an optimized level as soon as possible. And that's when most likely Dr. Salim would prescribe the growth hormone.
Right. Okay. Yeah, it makes sense. So thank you for the lesson. Goodness gracious. I never heard of it before. I'm grateful.
You got to look up peptides, newest stuff.
For sure. It's out of my scope right now, I think. I'm looking to learn more though. What if you're a physician or a naturopath like me, and you can't use these, but want to be supporting patients who are getting the benefit out of your company? Like, should naturopaths reach out to you for support? How should they do this?
100%. They can email support@getgambit.ca. And that, I have a big team. They'll definitely, if they just say, I'm a naturopath doctor, I heard you on, the Vitamin Lab podcast. I wanted to get some support we're happy we do we set up almost like a clinician partnership with them. And that way we also can, if the patient consents, obviously, we can share the data with your allied health with them. And we make clinical decisions together, and we're always available to discuss, if they have a question or if they want us to talk to the patients directly. And basically what we do is if the patient consents for them to share their data with us, then they can usually send us the patient's data. We'll contact the patient. They go through obviously the proper channels, which is the intake form, the legal terms of service, all of that. And then we get them on either the blood work, and we can look at which blood work you've done already and how recent it is. And then we can, if you don't have some of the items that we're testing, we'll test you on those, get a formal diagnosis going, and start therapy. And I think you've sent me even, some women as well, like their libido was really low due to low testosterone, and we can get them on microdosing testosterone. The other thing is, women do benefit a lot also from the sermorelin and the anti-aging and all that. So these are all things that we can help naturopath with. We have actually referral forms as well that we offer family doctors. Mm-hmm. So a lot of family doctors will be like, hey, I have like 50 patients that, they're in the lower range. It's out of my expertise. They know you're a private clinic. Are you able to help them? Mm-hmm. So we get referrals from family doctors, naturopaths all the time. Yeah.
Yeah, it really does make sense to be working with someone who knows what they're doing. What if you're a patient? How can patients find you? Where can they find you? How can they reach out? And who do they meet with initially?
So what the first thing they really want to do is getgambit.ca. There's a small fee. It's about $50, but I think we're putting together, if I'm not mistaken, a code for Vitamin Lab podcast listeners. So we're happy to send that over once it's live, but I think it's going to be GGVL99, and that gives you 99% off the initial intake form costs reviewed by the specialist, which is usually like $100 to $50. So that'll get you it for $1 or 50 cents. TRT is the $50, I think, and the HGH is $100. So that's a good way for you. All summer, we're going to run this promotion. That will allow you to fill your intake form, and that really will let us know your symptoms, any past medical history, family history, any of the stuff that we would require. Like if you were going to the doctor and a nurse was taking in your intake, all those questions are designed by condition to be answered properly. Once we receive that, then you get a clinical call. The doctor would review that. He would have one of the clinical staff give you a call. We would talk to you about the program. There is a cost for that comprehensive. I think they're running a promotion. Usually that panel that's 50 over is about $825. Right now they have it for $485. And guess the kicker, if you don't qualify for testosterone therapy, we will actually refund you $460. So if we can't help you, even though you got all those things tested, so you still get the 50 markers tested, you still get Dr. Salim's insights, you still get a meeting with the clinical team. And if Dr. Salim says, hey, you know what, testosterone is not going to help you here, or HCG, and this is not what's right for you, you may need some lifestyle modification, we actually refund you 90% of the fee. And you still get all of those insights. So it's kind of like, we're only trying to help you. We're not trying to work with you. If it's managing your cholesterol, your family doctor can do that. Yeah. But if you're here for hormone optimization, anti-aging, and we can help you, then we're happy to. So going to the website, if you want to even send an email to support@getgambit.ca, they can book a call right away with you. If you just say, hey, I heard you guys on the Vitamin Lab, podcast, then they'll definitely give you that deal right away, 99% off the initial consult, applicable to the intake form, fee. And that will at least give you something called your eligibility test. So even if you don't, let's say you're like, you know what, $400 a lot. I don't want to spend that right now. I just want to test. We will test your testosterone for free right now. So that's what you're paying for. It's just the intake form reviewed by the specialist and the issuing of something called the eligibility test, which is just your serum testosterone and your free testosterone. So we'll test those two things for you because it's good to know, right? Maybe you don't need to do the comprehensive. Maybe you're doing some of that with your family doctor and you just want to see if your levels are low. You literally send us an email, fill out that intake form, and we'll test you for free.
That's awesome. Well, thank you for the review. I really appreciate it. I think people will benefit from just hearing about the process because it's kind of scary to jump in, if you don't really know what's coming, it's kind of freaky. You know, you haven't seen, like most men, you know, in their 40s and 50s, haven't seen a doctor since they were young.
Yeah.
Right. So like talking to someone about them, oh my goodness, really difficult. So it's nice to hear something like this is available for Canadian men and they can go and check it out and try it.
And even for women, that's the
And
best
women
part.
too,
So
exactly.
so we do full HRT for women. We do all the anti-aging. We do anti-wrinkles for skin therapies as well. We do the full. Like the newest stuff we're doing is nutrigenomics DNA testing, which is crazy. So you're looking at 77 allele genes that actually will give you a 45-minute consult with a registered dietitian that's trained in reading these genetic tests. Pretty cool stuff. And then we look at that with your blood work, and then we put a plan that's really personalized to you, and we tweak, right? And that's the best part about it, is that you actually feel like a person. You're not a number. So that's really what distinguishes us from other companies. The other thing that distinguishes us is that we work with specialists. You know, we make sure that they're an expert at what they do. So it really allows us to be able to help people in a different manner.
Love it. Love it. True personalization at work. Well, listen, Issmaeel, I really appreciate your time. It was so great learning from you. We integrated some of the naturopathic, some of the holistic stuff into the conversation. We got to talk about some vitamins and herbs a little bit, but really for me personally, coming from my world, just learning about your process and what people can expect and what it's like has been so valuable. So thank you so much for your time. I really appreciate it.
No, thank you so much for having me. Honestly, it's been a great pleasure. Happy to come anytime. Happy to answer any of your questions offline as well, David. I'm sure we're going to keep talking, and it's just been a complete honor to be here. Thank you so much.
Awesome. Well, thanks so very much for joining Personalized, and we'll talk again soon.
Thanks for joining us for today's discussion. What about today's podcast resonated with you? Be sure to tag at Dr. David Dizer and at Get Vitamin Lab. If you're learning from and enjoying this podcast, please let us know by subscribing to our YouTube channel and follow the show on Spotify and Apple. And don't forget to leave us a review. It's the best way to support our podcast, and it helps others find us. To learn more or book a demo to explore what personalization could do for your practice, please go to www.getvitaminlab.com/personalized.